Hi, and welcome to this McKnight's Workforce Development Forum. You're tuned in to Understanding the New Reality, Mental Health and Personal Well-Being in a Post-COVID World. I'm McKnight's Executive Editor, Jim Berkland, and I'm your moderator. Our topic today probably touches everyone in the long-term care workforce setting today. Taking care of yourself in a post-COVID world is critically important. Well, we're going to hear from one of the foremost experts on this topic. But first, we have some housekeeping matters to take care of. The slides will be available for download and printing out if you wish. Just go to the download bubble on your screen and print them out for following along. If you are having audio problems, please first check the volume control on your machine because this is the most common cause of these problems. You also have a help button to use if your own troubleshooting doesn't work. Also, we will have time for a Q&A segment near the end of the presentation today. If you have any questions for our speakers, please feel free to tap them out and submit them directly to us. Starting now, in fact, we'll see them on our end and we'll bring them in when we go to that segment. Those we don't get to in real time will be answered afterward. Now, regarding continuing education, this educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards and approved for 1 clock hour. But you need to stay tuned into this event for its entirety during the original broadcast in order to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed through the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display and the required viewing duration will show a green checkbox. You can then view or save your certificate. A copy also will be emailed to you afterward. Now, we'd like to note that this program is made possible by support from CARE. Please visit the fine folks there at doyoukare.com. Finally, this session will be archived and available on demand shortly after this live broadcast. You can access it again, or others can experience it for the first time by simply going to the registration page to enter this studio. The URL is mcknights.com/081324 Workforce Development Forum. Don't worry, I chuckle because we'll show that to you on a slide at the end too. Now, I'd like you to meet our presenters. Jean Hartnett is a visionary healthcare leader, expert in trauma-informed care and adverse childhood experiences. She has more than 30 years of executive experience serving the older adult population. That's included work as a healthcare executive, college professor, consultant, and strategic advisor for large and small health systems across the United States. Katie Roan is the Senior Vice President of Hero and Employee Experience for CARE. She oversees programs and research aimed at understanding and addressing heroes' needs so they are considered in every aspect of care. In addition, she oversees CARE's own employee organizational strategy. So, Katie, I have to say, as I indicated a little bit earlier, today's topic isn't always something professionals probably flock to talk about. Is that fair to say?
Yes, Jim. It definitely isn't something that is something that folks are talking about, although it's gaining a lot of momentum and it's gaining a lot of speed out there in the industry as we look at the state of mental health amongst the workforce. So I'm excited today to be able to share this original research.
Well, I was going to say we're glad to have both of you back, and I know the research is going to be very enlightening to the folks on the line, and I think we all have something great to learn here. So if you're ready, why don't you take it away?
Perfect. Well, thank you so much. And it is an honor to be back here at the August Workforce Development Forum with McKnight's and to be with also my co-presenter and partner, Jean Hartnett, who Jean has really been blazing the trail in talking about the impact of trauma on the workforce, or what we call careforce, and what organizations can really do to help to retain and really build resiliency among that workforce. So Jean, I know that we've started off our last presentation about our first trauma and resilience report with this slide. And I think this really kicks off and starts off the foundation of what we're looking to do here today.
Well, absolutely, Katie. And thank you, and thank CARE, and thank McKnight's, and Thank you to the over 1,000 registrants that we have on this forum today for joining us to talk about this important topic. So you're right. We really have kind of patterned our talk after this quote from Maya Angelou, which says that there's no greater agony than bearing an untold story inside of you. You remember that we said that as managers and leaders in senior care, we are aware that many of our employees have an untold story inside of them, and how having an understanding of trauma, which was that first report in our first webinar that we did with McKnight's, really allows us to start understanding the complex and challenging lives our employees have outside of our communities. And so this second report is really allowing a deeper layer. And it is giving us the opportunity to dive a little bit deeper without having to ask the difficult questions directly to our employees. We know that the conversation around trauma is deep, and so too are the conversations around employee health. Anytime I'm speaking to audiences about understanding trauma in their employees, I inevitably get this concern of like, geez, aren't we opening up that proverbial can of worms? Now with this first report and with the second report coming from CARE in partnership with NACA, the work of knowing and understanding what is happening in the lives of our employees has been done for us essentially. So thank you, CARE. Managers and leaders can use this data to understand from report 1 how childhood adversity has impacted our workforce, and now with report 2, how that childhood adversity and the COVID-19 pandemic has impacted both mental and physical health. Katie, could you offer some insight on how these studies were done?
Yes, absolutely. So the research was conducted in January of 2024, and the survey was sent out to all of our care heroes, which are licensed CNAs, CMAs, LPNs, and RNs. It was also sent out to the members of NACA, the National Association of Healthcare Assistants. So we had 1,142 responses. And the research and the data was really broken into 3 sections. First, focus on adverse childhood experiences and the impact of toxic stress on the careforce. The second one, what we're talking about here today, the influence of mental health and the impact of COVID on mental physical health, along with workplace well-being. And then the third report, which is focused on social determinants of health. That is, does our careforce have enough? Are they able to pay their bills? Are they able to have transportation to get to doctor's appointments? All those questions around social determinants of health. We were overwhelmed by the amount of data that we had. That we are releasing this in a 3-part series. Today, part 2, you guys are seeing the first glimpses of some of the data and the insights, and then you will have an opportunity to be able to sign up to actually get the full report. But really at the basis, though, of this entire series is the foundation of the baseline of talking about adverse childhood experiences.
Well, let me jump in then and talk about those as more of a refresher for individuals that were on our last webinar, and maybe for those who weren't on our last webinar, just provide an overall perspective of where did we come up with these ideas. So adverse childhood experiences are what Kaiser Permanente and the Centers for Disease Control and Prevention found in 1998. There are 10 categories of childhood adversity that many of us have experienced. And such things as child abuse, physical abuse, verbal abuse, incarcerated individuals in your family, drug and alcohol dependent individuals in your family. These 10 categories, Katie, really impact how we matriculate from childhood to adulthood, and then of course from adulthood to elderhood. And this original study was done in 1998, and then CARE picked up the baton and really said, this is interesting stuff. Why don't we go ahead and ask these questions to our workforce? And that formed the basis of Report 1.
Mm-hmm.
So what we found in the report, the original the original research that was done by Kaiser Permanente and the CDC, is that ACEs really does have a direct impact of how we manage chronic disease, whether or not we're going to end up with a behavioral health issue, whether or not we're going to end up being drug or alcohol dependent. And what the ACEs study found is that if you have 4 or more of those 10 original categories of ACEs, you are at a higher risk of toxic stress. What we know about toxic stress are individuals that are coming to our communities on high alert all of the time. So if you're lucky enough to have 0 ACEs, you're likely to have a low risk of toxic stress. If you have 1 to 3 ACEs, you're likely to have a medium risk for toxic stress. If you have 4 or more, then you're really going to be in kind of a toxic stress mode throughout your day, whether or not you're being triggered by those adversities or not. So we want people on this call to keep these levels top of mind, and we're going to reference them throughout our presentation. But Katie, I wanted to see if you could walk us through some of the key findings we found in that first study.
Yeah, so in the first study that we did, so what we compared the US population of, again, the original Kaiser Permanente study, where 64% of the general population has at least one type of ACE. We found amongst our careforce, we have 73% have at least one type of adverse childhood experience. Now, when you look at the general population, for 4 or more types of ACEs, they sit at 17%, where our careforce is double. So again, I want everyone to think about that when you think about the makeup of our careforce. We have 34% that are in that 4 or more ACEs, so that they are in that high toxic stress risk environment. And then we have 73% that are at basically medium. So I think that's something to just keep in mind as we think about, as we're going into, okay, what's the impact on physical and mental health?
Thank you for that, Katie. I think that that's really important for people to keep in mind, how our particular population of employees that we work with are significantly impacted by childhood adversity. So if they have 4 or more, again, they're coming to our communities in these high toxic stress situations. So in the second report, it was important for us to dive a little bit deeper. And we examined how ACEs and COVID-19 had an impact on the physical and mental health of our employees. So we asked specific questions related to, how did your ACEs score have an impact on your mental and physical health? And then how did the COVID-19 impact have an impact on your physical and mental health? And here's what we found. We found that 1 in 4 individuals in the careforce report that their ACEs score had a negative impact on their current physical health. We found that 2 in 4 of individuals in our careforce report that their ACEs score negatively impacted their current mental health. So as you can see, these things that have happened a long time ago are still impacting the individuals that come to our community, both from a physical and mental health standpoint. So I'd be interested in looking at the COVID-19 data. Do you have that, Katie?
Yeah, I do. So when we look at then the impact of the COVID-19 pandemic, it was indicated that almost half of the careforce has felt an impact on both their physical and their mental health. I think this is where, again, going back to what we know about an individual is at a high toxic stress level, that the COVID-19 pandemic, for those with that high toxic stress, had a greater impact on their physical on their physical health. And those that had a low risk, they experience a doubling adverse negative effects on their physical health as well too. So Jean, when we look at this, like what does this mean?
Yeah, well, goodness. In short, it means that whether you're at high risk for toxic stress or low risk for toxic stress, the COVID-19 pandemic took a physical toll on everyone. People with a higher toxic stress are more susceptible to illness, accidents, maladaptive coping mechanisms, and so on. So here, Katie, COVID-19 took no prisoners, whether you're in the low toxic stress or the high toxic stress categories. The COVID-19 pandemic had a lesser impact on mental health, the report shows, but we need to look at this again, the mental health impacts, I believe, in 1, 3, and 5 years, when the reality of the COVID-19 pandemic has moved from physical ailments to mental health ailments. It's not uncommon when people experience trauma to have the physical symptoms show up first before the mental impacts. We are still all mentally processing what happened to us during the pandemic. So communities can start surveilling their data sources that may point to not only the physical effects, but the mental effects that are occurring with their employees, such as an increase in incidents and accidents, an increase in med errors, an increase in sick calls, and so forth. And I don't want to get too ahead of myself in terms of looking at recommendations, but I think it's important to call that out on this slide, since again, COVID-19 took no prisoners whatsoever.
And I think just to add to that, as I say, Jean, also to add to that as well, what we also know from the first report is that we have 65% of our care force that has also never sought mental health support or therapy either. So when you talk about that, it is felt first physically before mentally. We also then have a workforce that also isn't necessarily getting the help that they need.
Oh my gosh, such a good call out. And, it's one of those things where we really have to key in on behalf of our employees because they're just not recognizing it in themselves.
Yeah. So after we kind of had an understanding of what are the impacts then of mental, physical health from COVID and from past childhood experiences, we wanted to move into understanding kind of the overall perception or what we are calling workplace well-being. So we asked 6 questions across these 4 categories: safety, sense of community, inclusivity, and respect. And I'll actually be getting into what were the actual questions that we asked. Now, we're gonna be sharing kind of some overall total population data, but I want everyone to know that these are within each one of these, there is nuanced data and information in the report that really calls out some key differences. One of the 2 ways that we looked at each one of these categories around workplace well-being is we looked at it via toxic stress levels. So individuals with that high toxic stress, what did they think about these categories versus the medium risk versus the low risk? And then we also looked at it via license type as well. And I'll say that overall, it's no surprise that those individuals with high toxic stress levels, so again, they have 4 or more ACEs, that's 34% of our workforce, they overall were more negative about each one of these categories. And Jean, do you have any insights into why that would be?
I absolutely do. People with high toxic stress levels are usually consistently in 4 types of survival mode. They're in fight, freeze, or fawn. Neuroscience teaches us that when our central nervous system is in one of these modes, it's impossible for us to feel safe, to form a sense of community, to feel included, and most definitely to feel respected. When you're in fight, flight, freeze, or fawn, you are accessing only the survival component of your brain. What those four categories above speak to are being more in your mammalian brain, governed by the prefrontal cortex. That prefrontal cortex is responsible for critical thinking, for reasoning, empathy, and so forth. So when we look at these four categories and we understand that basically 34% of the individuals that work in our communities are in high toxic stress, that means that they are likely in these four survival modes, which means they can't access these sense of safety, community, inclusivity, and respect.
Mm-hmm. So to dive into these a little bit further, so in particular around safety. So we asked two questions around psychological safety. The question was, in the workplace, I'm encouraged to share creative ideas without fear of judgment. And then interpersonal safety. In the workplace, I am safe sharing feedback with others. And as a total population of the careforce, 58% agreed with this question. Same with then 61% agreed with interpersonal safety. And again, these are total populations, but as Jean pointed out, there are nuances amongst these numbers.
That's exactly right. And I love this good news. Trust and believe me, this looks really good from my perspective. However, there are things that what individuals take away from this call is you've got to go to that report and really see how these numbers are manifesting, like you said earlier, based on role type, but also those individuals that have high toxic stress levels. I don't want to give the impression that everything is good and fine in our communities because of these really positive looking percentages. It's important that people scratch the surface a little bit deeper. And I don't know that in long-term care, I know when I was an administrator, I probably would have taken this information and this data at face value without diving a little bit deeper. But we need to do that, Katie.
So let me move on to the next one around sense of community. So this was the question that we asked was, in the workplace, I am a part of an innovative and strong community. So the total population of careforce, 58% agreed with this question. Again, I'm going to talk about one particular role type and their thoughts and feelings around this. But overall, we have over half that is in agreement to feeling a sense of community. Same with inclusivity. So in the workplace, I am able to be my true, authentic self. This was actually a great, when I saw this data, I was like 77% agree with feeling this, that they are able to be their true, authentic self. So this is, again, I thought this was great data and information for how individuals are feeling within the workplace. And then lastly, this is our category around respect. And we broke this down into two questions. One is around mutual respect. So in the workplace, I am respected by my peers. 77% agreed to this statement. And then with recognition by management, so in the workplace, I am respected by the management team, 69% agreed overall with this statement as well. And so this is, again, good news with this data and this information. I think that the next slide that we want to spend some time on is when we started to break it out by role type in particular. And there was one role type that definitely had a much different experience and or had different feelings about kind of each one of these categories. And that role type is registered nurses. So let me get this data up here. Registered nurses definitely had a different feeling about each one of these categories and each one of these questions. I'll say that overall, CNAs and CMAs, those certification types, were very positive. But when it comes to safety, only 44% of RNs reported feeling psychologically and interpersonally safe, which is really 12% lower than the general population overall. And then when you look at sense of community, those differences, 29% of RNs disagreed with feeling a sense of community, which that was 13 percentage points more than the total population. So again, not feeling as much of a sense of community. And then looking at inclusivity, so on the other side, only 34% of RNs find that they disagree or strongly disagree with the ability to be their true, authentic self, as compared to 12% of the total population. And then 18% of RNs felt unrecognized in the workplace. And these were some stark variances in the data that we saw amongst this role type. So Jean, let's talk about this. Like, what does this mean and what do we do now?
Yeah, such a great question. And I'm wondering how people are feeling on the call that are participating when they see these percentages. Particularly if you are a registered nurse, and particularly if you are a registered nurse that's in, one of those massive management and leadership roles where you've got so many direct reports reporting to you and so much responsibility from a hierarchical standpoint, those that you're beholden to from a management structure. And I think what this tells us is that you and I called this our Mayday slide. We were looking at this, feeling really good about the overall categories and how the percentages were coming out. But this is why CARE looked at role type, to really understanding which role is having the most difficulty. And I think I was a little surprised, but not so surprised by this data, just given what I recall I would put on the shoulders of my registered nurses when I was an administrator. And we're expecting so much of this role type that it's almost, it's a call to action to rethink the role of the nurse and just how much we expect of them. We have to do a lot of work to fortify registered nurses in our communities in all of these areas. We really expect our nurses to do so much, like I said. And even though the frontline team members in these 4 categories are responding positively, I have to ask myself, how long is that going to last when their leaders or the RNs are feeling this unsafe, this much of lack of community, not included and disrespected? It's not going to last very long in terms of having our frontline team members responding positively to these categories. And I would even hypothesize to say that these types of statistics also trickle over to patient care. So if anyone is to leave this call with a call to action, it's really to read that section of the report to understand what these areas mean. I mean, this literally has banished the notion that once you are in a management and leadership position, you've got it made. Well, these individuals in our communities are telling us exactly the opposite. It's that their work has become 1,000 times harder. So I wonder if it would be important to get to some recommendations on what communities can do.
Yeah, absolutely.
So, when I reflect on the previous slide, I really remember, Katie, being in an organization. And overall, this is just kind of an overall approach to how I see this data. This nurse manager came to me and she said, Jean, at this organization, we just want to fit in here. That's That's what we want to do. Everybody wants to fit in. They want to be a part of the team. And when I left the conversation with the nurse, Katie, I said to myself, I think that's wrong. I think that instead of fitting in, I believe that all of us want to belong to an organization. Fitting in means you're changing yourself in order to align with the organization's mission, vision, value, or the culture of your working unit. Whereas belonging really means that you're bringing your true and authentic self to the organization. So, what I think people can do as a takeaway from this call is ask themselves, am I, as a leader, in fostering an environment where employees can show up as their true, authentic selves? Or have we created an environment where people are expected to fit in? As you know, Katie, people can go along to get along with just about anything before a person's true nature comes out. And that's what's so encouraging about this report, because it allows the data behind how it gives us the data behind how employees are feeling about some really sensitive topics. No longer can managers and leaders say, oh, that employee has a big chip on their shoulder, or gosh, they really aren't buying into the program. These reports really shine a light on the extraordinarily complex lives employees live outside of our workplaces. This report and the one before it allows all managers and leaders to go back to their communities, share the results, and ask, is this us? Is this you? And in my experience, I don't think managers and leaders have really done that. We haven't done a really great job of really understanding why we continually lose people, or why we're seeing our quality metrics decrease in resident care areas. We haven't really taken into consideration individuals' past trauma and their level of toxic stress. But now, as managers and leaders, we have to do that. We have to learn these skills on how to hold space for difficult conversations, asking the difficult questions, but then also being prepared for a difficult answer that you didn't want to hear. So in the report, we're recommending that organizations really think about enhancing psychological safety. And we recommend doing this by establishing regular forums and support groups where nurses can truly feel free to express their concerns and ideas without fear of judgment. Organizations, we're hoping, could really foster a culture of open communication and actively seek feedback from nursing staff to understand their unique challenges. Again, this report, or pardon me, these conversations with our nurses can start with this report, and we can ask the question of ourselves, is this data reflecting who we are as an organization? And do you see yourself in this data? If that's true, what can we do to change it? You know, I am not a nurse, Katie, you know that. And what I have learned over my career in long-term care is that nurses want to talk to nurses. And so my best advice to our non-clinical leaders on this call is to really find those nurse leaders in your organization and empower them with this information from the reports and allow them to speak to their teams about it. In other words, I would tell myself, if I was still managing a community, to get out of the way so that nurses can really have those safe and comfortable conversations with one another. With respect to improving inclusivity and respect, you know, having inclusivity training in the community and workshops to promote a more accepting and supportive work environment is super important. Recognizing and celebrating the diverse backgrounds and contributions of your team of nurses can really build a cohesive team. I have found also in my career, and now, you know, going into a lot of trauma-informed care data and research, that inclusivity and respect go hand in hand with the notion of a just culture and restorative frameworks. restorative justice frameworks. Nurses often feel singled out and responsible when bad health outcomes happen with residents or they have a poor survey. A just culture looks at the system failures, not the individual failures, and really looks at what we can change as a system. And it kind of removes that finger pointing. From the perspective of strengthening recognition programs, it's important that we implement robust recognition and reward systems that acknowledge the hard work of dedicated nurses. You know, I always say that when you become trauma informed and you're starting to understand more about the mental health of our workforce, we've got to move away from the water bottle and pedometer type of wellness programs and go like a million layers deeper to understand what's really motivating our workforce. It's important to find out just how people want to be recognized. I've made so many mistakes over my career, probably have more mistakes than I do successes in this particular category, because I thought every nurse wanted to be pulled up in front of the room and given a badge and really applauded by her peers. And what I have found out, and the data supports this, you know, that's not how everybody wants to be recognized. So in short, what I'm saying here is that we can't take a one-size-fits-all approach to how we support and recognize and reward nurses. From a sense of community standpoint, I really love organizations and have found success with nurses in organizations that really promote continuous education and career advancement opportunities. We've got to support professional growth in our nurses to enhance their skills, and that absolutely demonstrates a commitment in them and an investment in them. Some of the lowest hanging fruit in this category, I feel, Katie, is look at who's going to the conferences. You know, who is it? Always the same people that are getting to go on, you know, to the nurse leadership conferences or the MDS conferences. We've got to look at that from a professional development standpoint and really open it up to all nurses so that everyone has an opportunity to advance their career. Mm-hmm. I don't know, Kitty, if you have anything you want to add to these categories, if I've left anything out or anything that comes to your mind.
No, and I think going off of, particularly when talking about for professional development opportunities, I mean, we've done our previous research around what the careforce wants in regards to benefits, particularly around like non-traditional benefits, and providing that tuition reimbursement or educational support to pursue in a clinical field or even outside of a clinical field was one of the top areas that individuals wanted. And so I think that goes and hits a couple of these different things as well. But just thinking about, again, I think what the basis of these reports really do is it helps us to look at our entire workforce and our entire population and seeing how, okay, if we have individuals 34% that are in a high toxic stress state every day. And we know, and I don't know, Jean, we talked a little bit about this, but like how that can manifest itself kind of day to day. But oftentimes also those individuals, while they may be a bit more negative about some of these workplace categories, they also too want to be able to advance their career as well too. And so being able to identify maybe some of those opportunities and give those opportunities across your team and your workforce, I think will be really important.
I absolutely agree, Katie. And I think that when we look at, well, we're how many years post-COVID? 2 years or so post-COVID. And I know that I have mentioned to you in our private conversations that when a collective trauma like the COVID-19 pandemic happens to a society, it takes a minute to put language and storytelling and body sensations around what we just experienced. And I know that I have shared with you my research into Holocaust survivors and also kind of the whole notion of the Holocaust, that it really wasn't until 1969 to 1970 where we started referring to the Holocaust as Big H Holocaust, because it took us that long as a society to really understand exactly what happened. And I think that same kind of nuance, that same type of dynamic is happening when we look at the COVID-19 pandemic. And what's different here is that if we don't kind of arrest the symptoms and recognize in our care force what is happening to them, both physically and psychologically, then the outcomes that we're providing our residents, that quality of care and the ability to retain staff, is really going to be negatively impacted. And so I think that it's just really important that while COVID is in the rearview mirror, thank God, it isn't in the bodies and minds of individuals that were there during the pandemic providing care. So it's important to really understand what this report brings out, with married to that first report that tells us that individuals that have experienced 4 or more ACEs are going to have a more difficult time really managing and adjusting to a post-COVID world.
Mm-hmm. Yeah. I think what I'd like to do next, and I'm going to actually move to this slide, because as I mentioned, each one of the survey and the data that was done at the beginning of this year, each report is building upon each other. And at the end of the third report, we're going to have a really deep and robust view of the real challenges and the real opportunities that we have amongst understanding what the care force is. It has not only gone through in their past, but also what their current reality is as well. I put this slide up here. There is a QR code for those of you that do want to or have the chance to get this report. It's going to be coming out here any day. And so if you want to go ahead and scan that QR code, you can get the full data report for part 2 of our trauma and resilience series.
I'm so excited, Katie, for people to have this in their hands. I really am so grateful again for CARE. I know I keep saying that, but it's just really opened up so many avenues for senior leaders to look at the way trauma, COVID-19, and mental health is really impacting our workforce. And I know that when we talk about these categories and we look at the large amount of work that we have to do as managers and leaders in long-term care, when we go to our communities every day and we're just trying to dig ourselves out of what occurred, yesterday and what's ahead of us next week, it's really impossible sometimes to focus on these things. And what I always want to encourage managers and leaders to do is don't reinvent the wheel with this data. Don't go back to your board of directors or to your leadership team and say, okay, now we have this information from CARE. Now we've got to resurrect just another way to engage with and understand our workforce. What I really encourage people to do is leverage the functions and the practices that are already in assisted livings and nursing homes. So for example, new employee orientation. Why not add data from this report and information around what it means to be trauma informed and trauma aware into new employee orientation? Don't recreate a whole new system of education. Just embed this in new employee orientation. The same is true, kind of picking up and riffing on when I think about a new employee entering into a nursing home or assisted living. Is there any way that we can really access and leverage employee health? I feel like, employee health is one of those departments where we go for our COVID-19 shot, so we get a Tylenol because we have a headache, and we lift those bags of heavy sand to make sure that we are using proper lifting mechanics. But is there a way to really reimagine employee health where employee health can start looking at screening individuals for mental health challenges, screening individuals for social determinants of health, asking them if they want to take the adverse childhood experiences study or questionnaire, and then embedding that information, confidentially, of course, into how we manage and lead these particular individuals. So those are just, if I were, to do it all over again, if I were ever to get hired in an assisted living or nursing home environment, those are the types of things that I would think about, so I would not be so overwhelmed with what to do and how to operationalize this data. So yes, I am wondering if we have opportunity for questions, or if we have something that we can address.
I'm sorry, I'm jumping in. I just want to let you know we definitely have a couple questions here that we want to get in, and I wanted to thank you guys for some great material. This was really interesting research that we've talked about today, and I think it can be helpful for a lot of people. So, well, I'll remind everybody that they can send in questions on the tab at the bottom there. We'll see them in real time on our end. Those that we don't have time to get to, we will answer afterwards. And in the meantime, if you have had a chance to catch your breath there, Gene, I want to go right away. We've got Sarah has sent in one. It's kind of very interesting. Really, I'm sure numerous people are wondering about this. Are there any departments within our organization that could really help with bolstering employee mental and physical health?
Yeah, I think so, Jim. I feel as though I'm going to maybe highlight employee health as an organization or a part of our organization that could really help with having the entire organization understand trauma. And I think for so long, we have thought about employee health one-dimensionally. We have thought, is your fitness for work? Are you not sick? Are you well enough to come to work? And do you have proper body mechanics to lift patients? Like all of those things that we think of from an OSHA standpoint, and also being fit for work. I don't think we have taken enough time to really look at mental fitness for work and understanding just how important it is for our individuals that are coming to our communities, a large majority of them in that fight, flight, freeze, or fawn mode, that high toxic stress, that we're really asking them to turn around and to do these really high level executive functioning tasks on behalf of our residents. And we're literally shooting ourselves in the foot if we don't understand kind of what the complex lives they live outside of our communities in order to leverage that and help them get on a path to healing.
Great. Now, Gene, I think you may have clipped the one off that I was going to ask you about here. Julie had asked if you could just expand a little bit on the 4 Fs. We got fight, flight, freeze, and review that, please, if you don't mind.
Yes, absolutely. Absolutely. Well, they added a 4th. But, back in the day when I started my neuroscience deep dives, we were really looking at what is called survival modes, or the way in which our brain switches from the ability to think and reason and moves into what is known as the reptilian brain. So what this is basically, Jim, is that when individuals are in those high toxic stress levels, they don't have access to the part of our brain that allows us to critically think, that allows us to have good judgment, that allows us to think clearly through difficult problems. What happens when you are only able to access your reptilian brain, it's because you are in fight, fight, freeze, or fawn. And this is just evolutionarily how we developed as humans. We developed with that low functioning brain. That the reptilian brain helps us blink, helps us breathe, helps us know when we're hungry. But that's not enough for us to survive, as we know. So as mammals, as we developed the prefrontal cortex, which allows us to do all of those high functioning things. However, when you're in fight, flight, freeze, or fawn, because you're constantly impacted by the high toxic stress levels that occur within your body and your mind, then you're not able to do those high brain functioning activities. And that's like critical. We know that for our nurses, they have their whole job is about critically thinking through different aspects of patient care. And if they're not able to access that part of their brain, then we're just not going to have quality of care for our residents.
Very good. Well done on that. Okay, we've got another question from Kara. Jean, what is the role of EAP programs and how can those be better leveraged?
Oh gosh, what a great question. I have really thought about EAP as another one of those necessary but kind of hidden departments or hidden programs within our organizations. I don't think that we leverage our EAP, as everyone knows, stands for Employee Assistance Programs. Typically in nursing homes and assisted livings, we're contracting with an EAP provider. And, they come in my experience, come in maybe once a year, twice a year, set up a table and people rifle through and get their back scratcher and water bottle. But I don't think we have done EAP programs justice. Usually EAP is used as more of a stick than a carrot. Like if you have an individual that is in performance management or having performance management issues, we use EAP as like, well, you got to go talk to an EAP counselor to kind of get your behaviors under control. EAP programs are becoming trauma informed. So we shouldn't be using them any longer as a stick. We ought to be using them as a carrot and really change the minds around how people are accessing assistance. Because depending on who you contract with, chances are, Jim, they are going to have some really fantastic information around adverse childhood experiences, mental health, and how COVID-19 has impacted us all.
Very good. Well, now we've heard you guys really give out some great ideas, and this is a little bit tough, maybe even unfair, we'd say, for almost an hour here. And I'd like to ask each of you, and you may have hit on it already, but of all the points that you've made today and many things that we've gone through, if there's one thing that you must have the listeners leaving with today, what would that be? And Jean, I'm going to go to you first. Take a minute or two on this maybe to answer it. But really the one thing so that we know, okay, what's my action item or what's the highest priority?
The highest priority, Jim, from my perspective, is to group with your nurses ASAP. Let me use the medical terminology. Regroup with your nurses stat. I think if there's anything from this report that I think is the most important to highlight, it is look at that section of the report to understand how individuals are feeling about their well-being in that role type. It is definitely a call to action. It's the reason why Katie and I called it the Mayday slide. And again, it's the reason why reports and data like this are so impactful to our communities.
Outstanding. Now, Katie, what would be the one thing you really, really hope and need folks to do?
Well, I think outside of what Jean already talked about, and I'll probably say this, Jim, perhaps maybe at the end of each one of these reports, I think what I really, really want leaders to do when they are faced with a situation around an employee is really taking that focus from asking the question of, what is wrong with you, to saying what happened to you, and taking that trauma informed lens to understand and have a degree of empathy and understanding as to why maybe the behaviors that you might be seeing today, and really having that lens and that perspective. So whether that is the impacts of COVID or whether that's the impacts of past trauma, but really taking the insight of asking, what happened to you.
Outstanding. Throughout, really entirely taking some notes here has been a great idea. So I'd really like to thank our speakers, and I appreciate everything you have. We will be looking for that next report as well. Some great information, folks, coming out of this. So, and I hope everybody's enjoyed this presentation as much as I have. I just want to let you know, as promised, this is going to be an archive for the next year. You'll see the site right up there that you can go back into this environment that you came in today to see this again, or somebody can go in there for the first time. We want to give our special thanks to Jean Hartnett and Katie Rowe for some outstanding insight on this. And we want to thank our session sponsor, CARE. Check it out at doyoukare.com. And I want to thank you, our many listeners. You've been a big part of our success today with some excellent questions. And once again, thank you for tuning in to this Workforce Development Forum. There's more sessions coming up today. Please stay tuned. We look forward to seeing you again, in fact, at all of our future McKnight's events and webinars. This is Jim Berkland from McKnight's, wishing you good health and outstanding days ahead.